Good ma'am. My name is Biamawar Starion from Base Cream 1 Alpha. I'm going to discuss the natural and artificial method of contraception. There are 12 types of artificial method. First, oral contraceptive. Second, transdermal path. And third, vaginal ring. Fourth, subdermal implants. And five, hormonal injections. Six, intrauterine device. 7. Chemical barriers. Number 8. Diaphragm. Number 9. Cervical cap. 10. Male condoms. 11. Female condoms. And the 12 last is surgical contraceptive methods. Prevent pregnancy by avoiding unprotected vaginal sex during most fertile days. The couple prevent pregnancy by avoiding unprotected vaginal sex during the first and last estimated fertile days by abstaining or using a condom. What are the disadvantages of oral contraceptive? It, it can increase your blood pressure. It does not protect you against sexually transmitted infections. Breakthrough, bleeding and spotting is common in the first few months of using the pill. It has been linked to an increased risk of some serious health conditions such as blood clots and breast cancer. The advantages of oral contraceptives. The birth control pills is a safe, simple, and convenient way to prevent pregnancy. It also has other benefits like reducing and making your period lighter and more regular, and easing menstrual cramps. The side effect of oral contraceptive. The most common adverse effect of combined oral contraceptive pills is breakthrough bleeding. Women will also complain of nausea, headaches and abdominal cramping, breast tenderness, and increased vaginal discharge or decreased libido. Nausea can be avoided by taking the medication at night before sleep. Second, transdermal path. A transdermal patch use acts as a carrier for a drug, holding it until it applied. At the point of application, the path's adhesive secures it to the skin, and the drug contained in the path will begin to permeate into the bloodstream. The advantages of the transdermal patches. Transdermal patches deliver drug directly into the circulatory system, bypassing the gastrointestinal system and avoiding the hepatic first pass effect. This delivery system is advantageous for the treatment of depression with monoamine oxidase inhibitors. The disadvantages of transdermal patches. The main disadvantages to transdermal delivery systems stem from the fact that the skin is a very effective barrier. As a result, only medication whose molecules are small enough to penetrate the skin can be delivered by this method. The side effect of transdermal path: bloating or swelling of the face, arms, hands, lower legs or feet. And the third, vaginal ring. How is a vaginal ring used? To use a vaginal ring, you squeeze the ring and insert it into your vagina, like inserting a tampon. It stay in your vagina for 3 weeks. You then take it out and throw it away and wait 7 days before inserting a new ring. Disadvantages: you may not feel comfortable inserting or removing it on your vagina. You can have spotting and bleeding in the first few months. It may cause temporary side effects, such as increased vaginal discharge, headaches, nausea, breast tenderness, and moist changes. The advantages: if used correctly, the vaginal ring is more than 99% effective. One ring provides contraception for a month, so you don't have to think about it every day. You can continue to have sex with the ring in this place. Unlike the pill, The ring still works if you have sickness or diarrhea. What are the effects of the ring? The most common side effects are spotting or bleeding between periods, sore breast, nausea, or headaches. But these usually go away after 2 or 3 months, and they don't happen to everyone who uses the ring. You may also have a little extra vaginal wetness when using the ring. Number 4. Subdermal implants. Subdermal implants, contraceptive use implants, involves the delivery of a steroid progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. The period of protective depends upon the specific progestin and the type of polymer. Disadvantages of subdermal implants. You may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Your period may be irregular or stop altogether. You may get act or your act might get worse. The advantages of progestin implants include long-term contraceptive action without requiring the user or provider's attention, low dose of high effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. The side effect of subdermal implants: nausea, stomach cramping, bloating, dizziness, headache, breast tenderness, act, hair loss, weight gain, and vaginal irritation. Discharge may occur, pain, bruising, numbness, infection, and scarring may occur at the site where the rod is placed. Number 5. Hormonal injections. Hormonal injections used. How do I use the contraceptive injection? A doctor or nurse will inject depot into the muscle tissue in your arm or bottom. For continued contraceptive protection, this should be repeated every 12 to 14 weeks. The advantages and disadvantages of the injection. It's an option if you can't use estrogen-based contraception. You do not have to remember take a pill every day. It's safe to use while your breastfeeding is not affected by other medicines. The side effect of hormonal injection can include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your period may become more irregular, heavier, shorter, lighter, or stop altogether. Number 6. Intrauterine device. Use. The doctor will put the IUD in a small tube that they insert into your vagina. They move the tube up through the cervix and into the uterus. Then they push the IUD out of the tube and pull the tube out. Strings attached to the IUD will hang 1 to 2 inches into the vagina. The advantages and disadvantages of the IUD. It protects agent pregnancy for 5 or 10 years depending on the type. Once an IUD is fitted, it works straight away. Most people with a womb can use it. There are no hormonal side effects such as angst, headaches, or breast tenderness. And what are the side effects of an intrauterine devices? Risk: headache, act, breast tenderness, irregular bleeding. 7. Chemical barriers. Chemical barriers use also protect agent infection by pathogens. They destroy pathogens on the outer body surface, at body opening, and on inner body linings. Sweet mucus, tears, saliva, and breast milk all contain antimicrobial substances such as the enzyme lysozyme that kill pathogens, especially bacteria. The disadvantages of chemical barriers. What are the disadvantages of barrier method of birth control? These methods do not prevent pregnancy as well as IUDs or hormonal form of birth control. Bar method prevent pregnancy only if you use them every time you have sex. You may have to interrupt sex to use some barrier method of birth control. The advantages of barrier methods. The main advantages of barrier method, like condom, is protective against sexually transmitted infection and HIV/AIDS for individuals at risk of STIs. The condom use is critical. The side effect of the chemical barriers. The specimens used with the diagram can increase the risk of getting HIV from an infected partner. Use of the diagram and spermicide may cause vaginal burning and initiation form of spermicide. Use of a diagram and spermicide may increase the risk of urinary tract infection (UTI). Number 8. Diaphragm. The diaphragm is the primary muscle used in respiration, which is the process of breathing. This dome-shaped muscle is located just below the lungs and heart. It contracts continually as you breathe in and out. Advantages of a diaphragm or cup. You only need to use a diaphragm or cup when you want to have sex. The disadvantages of a diaphragm or cup. It's not as effective as other types of contraception, and it depends on you remembering to use it and using it correctly. The side effect of diaphragm. Most young women who use a diaphragm have no problem with it, but possible side effects include from the spermicide, erosion of the vagina and surrounding skin, or an allergic reaction, strong odor, or vaginal discharge if the diaphragm is left in too long. Number 9. Cervical cap. The cervical cap keeps sperm from entering the uterus by covering the cervix. For added protection, spermicide is put into the cap before inserting the cap saginally over the cervix. The cap can be put in several hours before having sex and must be left in at least 6 hours after sex. The disadvantages of cervical cap. The cervical cap has a few disadvantages that include not the most effective form of birth control, does not protect against sexually transmitted infection (STIs), easy to use incorrectly. The advantages of cervical cap. Unlike the diagram, the cervical cap protects against pregnancy for 2 days, 48 hours, and for multiple acts of intercourse within that time frame. But possible side effects may include from the spermicide, erosion of the vagina and surrounding skin, or an allergic reaction, strong odor, or vaginal discharge if the cap is left in too long, an allergic reaction to the material in the cap. This is rare. Number 10. Male condom. How a condom works. Condoms are a barrier method of contraception. They are made of very thin latex rubber, polyurethane or polyisoprene, and are designed to prevent pregnancy by stopping sperm from meeting an egg. They can also protect against STIs if used correctly during vaginal, anal, and oral sex. Some advantages of using condoms. When used correct and consistently, they are a reliable method of preventing pregnancy and protecting both partner from STIs, including chlamydia, gonorrhea, and HIV. The some disadvantages include some couples find that using condom interrupts sex. To get around this, try to make using a condom part of foreplay. Condoms are very strong but may split or tears is not used properly. If this happens to you, practice putting them on you to get used to using them. Condoms have no side effect. Most people can use condom with no problem. There are no side effects. Rarely, latex rubber. Condoms can cause irritation for people with latex allergies or sensitivities. 11. Female condoms. Used while holding outside of condom at close end. Squeeze sides of inner ring together with your thumb and forefinger and insert into vagina. It is similar to inserting a tampon. Using your finger, push inner right as far up as it will go until it rests against cervix. Female condom help to protect both partners from STIs, including HIV. When used correctly, the reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. Disadvantages of female condoms. They can slip out of place during sex. They can irritate your partner's skin. They might make the sensation of sex less intense. They slightly less effective at preventing pregnancy and STDs than male condoms. Do female condoms have side effects? When you used correctly, they are a reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. Number 12. Surgical methods. Some of the disadvantages of surgical sterilization include the following. It requires surgery, usually under a general anesthetic. There is a risk, albeit low, or surgical complications such as internal bleeding, infection, or damage to other organs. The advantages of surgical method: more than 99% effective at preventing pregnancy, blocking the fallopian tube and removal of the tube should be effective immediately, but use contraception until your next period. It will not affect your sex drive or interfere with sex. And there are 7 types of natural method. First, abstinence. Second, calendar method. And third, basal body temperature. Fourth, cervical mucus method. 5, sympothermal method. And 6, ovulation detection. And 7, coitus interruptus. First, abstinence. Abstinence method is simplify not having sexual intercourse. If you are abstinent, it means you decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving the opportunity for semen to enter the vagina. A sperm can't fertilize an egg if you don't have intercourse. What are the advantages and disadvantages of abstinence? The pros of abstinence include has no side effect or health risk, prevent pregnancy and the transmission of sexual transmitted diseases form. Experience showed that even people committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy. Second, calendar method. The rhyme method, also called the calendar method or the calendar rhyme method, is a form of natural family planning. What are the advantages of calendar method? Thus, by calculating the mind point of the cycle, women can also work out when they are potentially fertile and when they are definitely infertile. Sex can then be avoided or an alternative method of contraception used on the fertile days of the cycle. The side effect of calendar method. The biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle, and even then, it can be hard to 100% sure what days you're fertile. Number 3, basal body temperature. The method of basal body temperature can be used as a way to predict fertility or as a part of a method of contraception. By helping you gauge the best day to have avoid unprotected sex, tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effect. The disadvantages of basal body temperature. Temp- the basal body temperature method may not accurately predict ovulation in all women, including those with irregular menstrual cycle. It offers no protection from sexual transmitted diseases. The side effect of basal body temperature. Tracking your basal body temperature for either fertility or conception is inexpensive and doesn't have any side effect. Some women may choose to use the basal body temperature method for religious reasons. The basal body temperature method can also be used to detect pregnancy. Number 4. Cervical mucus method. The cervical mucus method is a way to identify fertile times to help you gauge the best day to have you or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is effective and doesn't have any side effect. Some women choose to use the cervical mucus method for religious reasons. The advantages and disadvantages of cervical mucus method. The cervical mucus method is a good for determining when you fertile by using your vaginal discharge as a way to determine where you are in your cycle. One disadvantage is that this method is not always easy to learn without the guidance of your CBG, gene, or doctor. Number 5. Symptothermal method. Symptothermal method, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs as symptoms of ovulation. The advantages and disadvantages of symptothermal method. A significant advantage is in effectiveness because it combines the calendar, cervical mucus, and temperature method. However, these techniques share the same advantages that each of these techniques has individually. The side effect of symptothermal method. Both these methods are associated with side effects, particularly in combination with other medication and tobacco and health complications including mood changes, acne, headache, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, wet chin, and uncommonly blood clots. Number 6. Ovulation detection. An ovulation home test is used by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects a rise in luteinizing hormone in the urine. A rise in this hormone signals the ovary to release the egg. What are the methods used to detect ovulation? There are several ways to detect ovulation, including urine test kits to measure LH level, transvaginal ultrasound, endometrial biopsy blood test to measure hormone level, and the basal body temperature (BBT) chart. What is the advantages of ovulation detection? By detecting a surge in LH, it helps predict when you will ovulate. Knowing this information helps you and your partner time sex for pregnancy. Number 7. Coitus interruptus. The withdrawal method of contraception, coitus interruptus, happens when you take the penis out of the vagina and ejaculate outside the vagina to try to prevent pregnancy. The goal of the withdrawal method, also called pulling out, is to keep sperm from entering the vagina.